I think my theory, and I'm sure that there's plenty of research out there to support this, but what I've personally anecdotally seen is yes, certainly an uptick in anxiety. And I think we're also just getting better at talking about anxiety. We are better able to recognize it. I think parents are recognizing it in themselves and in their children. Our educators are certainly getting better. There's whole curricula out there to support teachers and supporting their students who might be experiencing some kind of anxious distress or mood-related disorder. So I think we're getting better at identifying it. We're getting better access to resources for it. There's a lot of mental health that's embedded in schools. I think pediatricians as well are getting better at it. So I think that anxiety is a huge concern, and we're hopefully getting better at addressing it.
Why is it so pervasive over the past few years? What about COVID? What about these events that has caused this anxiety, you think? And how do you deal with it? What are the protocols?
Yeah, so anxiety really feeds off, in layman's terms, it feeds off of uncertainty and lack of control. We as human beings feel most comfortable when we have certainty and when we have this perception of, if I make a choice, then I know what the outcome is going to be. And so if you take that away from people, we start to feel distressed. We start to worry. We start to feel very uncomfortable. And so when COVID was all the transitions happening during COVID, those transitions make us feel uneasy because they are things that we can't control. We didn't know what was happening. We didn't know what to expect. We didn't know if there was a vaccine that was going to come out. And that's just me reflecting on COVID in particular. There's also a lot in the world that's going on that we have really easy access to with social media, with things like TikTok, we can go into, the pros and cons of all of these platforms, and access to information is so important. But at the same time, we're kind of constantly getting information, an overwhelming amount of information, some of which is really positive, but a lot of what media focuses on is the negative of what's going on. So it's a combination of feeling out of control, like what we do, we can't predict what's going to actually happen to us. And so we feel like we can't handle it. And that's the other piece of anxiety is lack of control and this perception of I can't handle whatever's going on. And so that's what makes us feel anxious. And so that's what I talk about all the time with my clients. I would say all of my clients, whether they meet full criteria for an anxiety disorder or not, the topic of anxiety comes up. And so we have these conversations about, are there certain things that we can do that would help us regain a sense of control? So we talk about, are there some coping skills that we could talk about? Is there mindfulness is a big topic of conversation right now, being more present focused, being able to sleep hygiene is another big one. So in
terms of the control, so a teenager, let's say living at home, it'll be hard. Like, where do they have control? They really don't. In high school, then they come home. At home, they don't really have so much control, and they're getting to the age where they really want to have it. They want to be on their own, or at least some do. How do you resolve anxiety in a teenager, let's say, versus someone that's like 30s, 40s, 50s? How does it manifest differently, and how do you work with them differently?
This is a constant topic of conversation with any of my teen clients and with their parents. One normal developmental experience that teens have is that they try to gain independence by asserting themselves in sometimes adaptive ways, but often in maladaptive ways. So people describe teens as being cranky, irritable, moody, hormonal, all of those things. And all those things might be true, but we also need to understand what's going on in the teen brain. There are so many synapses being created. There's so many hormones swirling. And we're not just talking about like puberty hormones. We're talking about all of the different hormones in the brain that help to manage impulsivity, inhibition, anger, management, just overall feelings, being able to make decisions. And so the teen brain is just overwhelmed with all of this stuff that's happening developmentally at that time. And so teens respond to that by having all these big emotions and having a harder time managing these emotions and just making decisions. And so often what I talk with parents and teens about is fighting. There's a lot of argumentation. There's a lot of, I don't want to do that. I hate you. That's not fair. A lot of these conversations happen. And so we do a lot of talking about, okay, so parent expectation, this is a common conversation. Parental expectations is that the laundry is done and folded and in your room, then the expectation is you need to put your laundry away, right? Or if you come home, eat dinner with us, then you clean your place at the table and put things in the dishwasher to help take the garbage out, right? Normal like chore, expectation, kind of routine stuff. Teens all push against that.
And having 3 teenagers, I have no idea what you're talking about. But yeah.